Thank you. I've yet to learn my lesson being bald-headed and wearing a black suit. Already I've been asked to make sure the water's been refilled in the back. A woman let me know that they were out of toilet paper. Somebody gave me their keys and said, please park my car. Anyway, I'm honored to be here in front of each and every one of you. I'm grateful to Dr. Wolfson, who's a pioneer in putting together seminars like this. And I'm hopeful that you will walk away today with something very valuable, that you will change the direction of your health. The unfortunate thing is I cannot keep still up here. I am one bundle of energy, so I'm going to be moving around, and let's get into it. You're probably wondering why I have a heart there that has a bunch of gears in it. So with that said, I'm going to explain that. And as this slide says, your health is defined by biochemistry and biomechanics. And you have just gotten an epic amount of information on how biochemistry affects the function of your heart and what you should do about that. You are now going to get epic information about biomechanics, the other side, the other part of your health, and how you can take control on how your heart functions. How you like that shirt there? Pretty cool, huh? It's the only one I own.
GMA on call. Millions of Americans take medication to lower their blood pressure, but new research suggests there may be a better solution. The idea is that some people may be able to toss their pills and visit a chiropractor instead. So how will it work? And is this method right for everyone? 1 in 3 adults suffer from high blood pressure. Nobody can say for sure what makes it rise, but now a new medical study is cautiously suggesting an unusual way to bring it down. Realign the spine. When the spine is misaligned, it can affect all types of things, all types of diseases, conditions. The idea is that the C1 vertebra, located at the top of the spine, operates like a fuse box in the body. When twisted, it can pinch arteries and nerves at the base of the neck, not only causing discomfort, but affecting blood flow too. Denise Neiman suffered from neck pain. The upper body's off to the left 2 degrees. X-rays show her C1 out of alignment. A special chiropractic adjustment lowered the pain and the blood pressure at the same time. My blood pressure dropped tremendously. Could there be a connection?
We designed a double-blind study to really look and see if, in fact, this procedure was affecting blood pressure.
25 patients got the special adjustment, 25 others a fake one. The ones who got the real thing saw their blood pressure drop an average of 17 points, a dip that usually takes 2 blood pressure medications to achieve.
So, what do you suggest?
But before you run out and get your neck adjusted, you should know that only a handful of chiropractors are qualified to do this kind of thing. The study is still being reviewed, and their blood pressure was still down 8 weeks later. Nobody can say for sure how long the adjustments will last. And we want to thank our fabulous Chicago station, WLS, for all their help on this story. Now, for more on the possible connection between your spine and your blood pressure, our medical editor, Dr. Tim Johnson, joins us now from Boston. So, Tim, what do you think of this study?
Well, it's obviously very intriguing, the idea that a simple manipulation of the neck might result in a very significant lowering of blood pressure. There are obvious limitations to the study. Only 50 patients, only 25 treated, only 8-week follow-up, a very special kind of chiropractor training required, but it certainly is intriguing and deserves further study, and in fact, a larger study is now underway.
And so tell us how, in theory, how does this work, realigning the neck, the spine?
Well, the truth is we really don't know, but that vertebra at the top of the neck is in a very critical area where the brain stem, the lower part of the brain, is involved with the regulation of blood pressure. So it's theoretically imaginable that changing the anatomy of that area might have some effect on the regulation of blood pressure.
And so people at home are, starting to feel around the back of the neck right now saying, so how do you know if it's in alignment?
Well, aside from having pain that might bring you to a doctor or to a chiropractor, you really wouldn't know unless you get an X-ray. And so intriguing question with further study that verifies that this might be a possibility will be, how do we suggest which people go and get their necks x-rayed and maybe have this kind of manipulation? There's a lot to sort out. But I'm telling you, the medical world will pay attention to this because of the very significant drop in blood pressure. And eventually, I think we'll sort out which people should go and have their necks x-rayed.
Well, that's huge, because that was automatically when I heard about this yesterday. My mother has battled with high blood pressure.
How many of you have seen that article or this in the news? I love it. This is who I used to work for, and Dr. Wolfson already spilled the beans. The Department of Energy in the field of nuclear engineering, designing nuclear weapons for Navy submarines. And I had a Q clearance, which was the highest security clearance you can get in the nation. But with that came the honor of looking at things logically, looking at things mechanically, looking at things in a form of a process. And I actually did an interview on ABC talking about, and the question always is, what does an engineer think about human health? And we're seeing more and more of this in the future. Why? Because if you look at the definition of engineering, it's a really great definition of what a doctor should be. We look at this. Engineering is a science, skill, and profession of acquiring and applying scientific, economic, social, practical knowledge in order to design, build, and maintain structures, machines, devices, systems, materials, and processes. In layman terms, it's the act of using insights to conceive, model, and scale a solution to a problem. What a great mission statement that would be for a physician. This is what I did, quite simply. As a nuclear engineer, look for signs of structure degeneration. And I also looked for signs of malfunction. So, in a nutshell, it was to analyze structure and function. What does that have to do with the heart? Well, because we know that structural degeneration, what we see up top, leads to malfunction. And in my thought, my logical thinking, my processes, I look at adverse health as a structural degeneration that has led to malfunction. So the question is, why do things malfunction? Well, I'm going to get into some physics here, and I'll try and keep it at a third grade level. My daughter is in right now studying this kind of stuff already. But the second law of thermodynamics tells us why. And if you're an engineer and you're sitting in here, you know exactly where I'm going with this. The second law is concerned with this word called entropy, which is a measure of disorder. And the second law explains that entropy of the universe always increases. What does that mean? It means that everything is tending towards disorder. Everything. Your car, your house, the air conditioner unit, your hair, right? The blow dryer. Everything that's mechanical is breaking down, including your health. Now, this is a picture explaining the second law of thermodynamics. And what we see is an ice cube in the form of a block of an ice, and we have an increase in entropy, which now goes to a puddle of water. If nothing is done to that block of ice, that's what's going to happen. But if we do something in the form of energy, then we can take and decrease entropy. So we go from organization to disorganization, or disorganization to organization, the second law of thermodynamics. The assessment of the heart. This is what I do. Now, I look for signs of structure degeneration, and I look for signs of malfunction. I analyze structure and function. The same thing as what I used to do. Because I know that structural degeneration leads to malfunction. Now, the picture on the left, that's one of my favorite pastimes right there. Chips and beer. Love them. And most people would look at that picture and say, based on what we've heard today, there's some bad biochemistry going on there, would you say? I don't look at that picture and say there's bad biochemistry going on, although there is. I look at that picture and I say there's bad biomechanics going on. I clue into the position of his neck. How is he sitting on that couch, right? With a remote in his hand, not moving, causing postural problems. And eventually we see what happens over on the right. That's why we're all here. This science of engineering moving into healthcare is called biomechanics. Biomechanics is this. It's the study of mechanical laws and their application to living organisms, especially the human body, and the locomotor system, which is what? Which is how and what I'm doing up here, constantly moving around. So nobody throws a shoe at me and says, when's this guy done? Can't hit me. But if you look at this, this is a X-ray, a full body X-ray on the right. If that doesn't convince you that you are mechanical, then I will over the next few slides. Here's another law that's affecting you right now. Has anybody ever seen this law before? This law is what's holding your butt in your chair right now, called gravity. This is the mathematical formula or explanation of gravity. It's another mechanical law that affects you biomechanically, besides the second law of thermodynamics. So the same laws of mechanics apply to you and your health. And here's where the crossover occurs. Because what an engineer calls structure and function, a doctor calls anatomy and physiology. Okay? And this is where we're going to cross over and start talking about anatomy and physiology. But a little bit more, who else thinks that we are mechanical? René Descartes, The Passion of the Soul, the description of the human body, suggested that the body works like a machine. It has material properties. The father of modern medicine. Hippocrates' own theory of medicine did argue the explanation of disease or health to the chemical breakdown of the body's mechanics. Biomechanics. Biomechanics. The human body is the only machine which there are no spare parts. A hip replacement is not a hip replacement. A knee replacement is not a knee replacement. And the human body is a machine which winds its own springs. The doctor of the future will give no medicine, but will hold conferences just like this, Dr. Wolfson. But will interest his patients in the care of the human frame. You are mechanical. What are you doing about that? The human frame. And in diet, biochemistry, we just talked about all that with all these leaders in the field, expert doctors in here. I'm honored to be around. And the cause and prevention of disease. And that's what you're learning right now. This was an excerpt taken from a paper written by a PhD recently, and it says, Concepts of Human Factors Engineering, the body as a machine. And it says, biomechanics has been around for many years. Relatively recently, and that's bolded, universities have decided to create a curriculum devoted to this subject. Just recently. Biomechanics is simply a term used to describe the combining of the human body with mechanics. Biomechanics involves mathematics, physics, anatomy, physiology, among other subjects. The body is considered to act as a machine with mechanical parts. Ball and socket joint, hinge joint, my jaw never stops. Can you manage the second law of thermodynamics? Remember the ice cube? You do nothing, it turns into a puddle of ice. You do something to, or a puddle of water. You do something to a puddle of water, it turns into organization. Here we see disorganization in a pelvis. Energy was applied in the form of doing something about it. And then we see the same pelvis on the right. What did we do to entropy? We decreased it. We didn't increase it. But something has to be done. Biomechanics. And this is how the explanation comes into play from the ABC News report that we all just saw. The picture on the right is a few segments of the spinal column, and this would be the front, This would be the back. This is a bone, disc, bone, disc, bone, disc, bone. This is the back. And here's where the spinal cord goes, down the back of the bones. And then off the spinal cord are peripheral nerves that exit through an opening that is formed by the alignment of the vertebra. And when that is open, then there's no nerve irritation. In engineering and electrical system, we call it impedance. As a doctor, I call that nerve compression. The picture on the right shows us what happens when we have a biomechanical misalignment. The second law of thermodynamics, gravity, causes these bones to shift backwards. When they go backwards, it decreases the diameter of the opening for the nerve root to come off the spinal cord. And we've labeled this a disease called spinal stenosis. It's not. It's bad biomechanics. And here's something that will show up on an MRI, a bulging disc, which is also not a disease. It's bad biomechanics. And furthermore, we see bony changes called Wolff's Law, right? Commonly known as osteoarthritis. That's the result of bad biomechanics. So the question is, what happens to those nerves when they are compressed? I've asked myself this question many times. And that's what happened to my hair. I scratched it all off. That's what I used to look like. Does anybody want to hear what happened to those nerves? Not from me, but what does the research say? Introduce the Windsor autopsies. After graduating medical school, Dr. Windsor was inspired to research. He planned to dissect human and animal cadavers to see if there was any relationship between any diseased internal organ discovered on an autopsy and the vertebrae associated with the nerves went to that organ. Pretty straightforward. He says the object of these necropsies was to determine whether any connection existed between minor curvatures in the spine on one hand and diseased organs on the other, specifically heart disease. Medical research. The University of Pennsylvania funded this in a series of 3, not 1, not 2, 3 studies. He dissected a total of 75 human and 22 cat cadavers. Hope nobody's a cat lover in here. Here were the results. 221 structures other than the spine were found diseased. Of these, 212 were observed to belong to the same sympathetic nerve segments as the vertebra and curvature. 9 diseased organs belong to a different sympathetic segment from the vertebra out of alignment. In other words, there was nearly 100% correlation between minor curves in the spine and disease of internal organs. Furthermore, here's all the results. I know it's probably hard to read. Right? So at the very top, all 9 cases of spinal misalignment in the middle back, stomach disease. And these are causes of death. Lung disease. All 26 cases of lung disease had spinal misalignments in the upper thoracic spine. Liver disease, gallstones, pancreas, spleen, kidney. Men, prostate. Prostate and bladder disease. All 8 cases with kidney, prostate, bladder disease had the lumbar L2, L3 vertebra misaligned, compressing the nerve. And then, of course, while we're all here, is what it says on the bottom. All 20 cases with heart and pericardium conditions had the upper 5 thoracic vertebra misaligned. Not most, not half, but all. Here's a unique neurological chart. The chart on the left, as an engineer would look at that, is the wiring diagram for the human body. The chart on the right is the autonomic nervous system. And I have highlighted in the red, right here, the upper thoracic vertebra, which is between the shoulder blades. And you can look at those nerves go straight into the heart. It's what governs and controls the function of the heart. And most patients will come in and say to me, well, I carry my stress there. No, you don't. You carry a biomechanical misalignment there that's never been corrected. Here are some patients, and I outline the x-rays with a red line. In an engineering term, that's called the center line of gravity. And if you start at the bottom of each one of those x-rays, and you go up to the top, and you see a kink, that's the upper thoracic vertebra, biomechanically out of alignment, damaging the nerve. And then everything else you will see on an x-ray, the electronics, is a pacemaker in every one of these patients. And just about every patient that I see, this is it. This is bad biomechanics, damaging the nerves, altering the function of the heart. Now, the video clip that we watched talked about the upper C1 vertebra. And this is how it works. In the autonomic nervous system, you have nerves that speed things up, and you have nerves that slow things down. The sympathetic nervous system, which is here, is responsible with the thoracic vertebra to accelerate heartbeat. The nerve supply in the upper cervical is designed to slow down heartbeat. If you have nerve electrical impedance in this system here, a mechanical misalignment, slowing down the electrical impulses, unable to slow the heart rate down, blood pressure goes up. If you have a mechanical misalignment here, decreases electrical impulses into the heart, it is unable to accelerate the heartbeat. You get arrhythmia, blood pressure goes down. AFib, a malfunction. By knowing this, and what the video clip talked about was the parasympathetic nerve system, right? Because that's all a diseased organ is. You run blood work, and you're either hyper or hypo, or in range. Hyperadrenalism, hypoadrenalism, hypertension, hypotension. But what controls that? Is it a disease or is it malfunction? All of these descriptions here are nerve innervation into the heart, the nervous system, right? There are nerves that speed the heart up. There are nerves that slow the heart down. There are nerves that regulate. Even though the heart has its own electrical system, it's still overridden by the brain and spinal cord and peripheral nerves. In fact, the picture in the upper left is a picture of your heart with the heart removed. So you can see all of the nerve innervation that controls the function of that organ. And who else said this? Hippocrates, the father of modern medicine. When in sickness, look at the spine last. No. Because that's usually where my patients come in. I'm the last resort. No, first. And here we are in 2014 doing research on something that's been around, and every doctor who graduates says the Hippocratic Oath. It's amazing. And then every doctor on the planet has had to study this book called Gray's Anatomy. Gray's Anatomy states the nervous system controls and coordinates all organs and structures in the human body. How do I know you have a biomechanical misalignment? The same way I would know if I analyzed a machine from an engineering perspective and I wanted to know if a part of that machine was not working properly, I would look for something called heat differential. And in fact, that's what I used to do. When you find abnormal heat, you find friction. When you find friction, you find mechanical misalignment. Now let's jump to the other side. When I measure the temperature of an individual's spine with this meter, I'm looking for heat differential, elevated areas of heat. If you take an ankle and you sprain it, what's the first reaction? It swells. What does it swell with? Inflammation. What is inflammation? It's heat. It's the same engineering physics that we would find in anything mechanical. You find heat, you find mechanical misalignment. You find mechanical misalignment, you find nerve compression. You find nerve compression, you're going to find a diseased organ. It's that straightforward. Whether it is your prostate, whether it is your kidneys, whether it is your stomach or irritable bowel syndrome, fibromyalgia syndrome. How many of you know what the word syndrome means? It means a collection of symptoms. That's all it means. Somebody in the hospital is begging God for the opportunity you have right now to step into your moment. Tony Robbins. Couldn't have said it any better. In my hand, I know you can't see this. This is a silver bullet. It was given to me last night by a very close friend of mine who is battling cancer. And I thought that I would use this today, not throw it at somebody. I won't do that. My wife was already asking, what are you doing with a bullet in your... She knows I'm a gun guy. My silver bullet to every one of you in here today is I am here. Number one, because I was asked by Dr. Wolfson to come and talk from a different perspective about your health, one that you may not have considered. And my silver bullet is this: I'm here to help everybody in this room. Some of you I already recognize are my patients. And I will do whatever it takes. I will offer a free x-ray if that's what it takes to get you to come in and look at yourself biomechanically and allow me to sit down and go through your spine with you, because it is that important. Please take me serious on that. I will stick around and ask any questions I can. I am one that can talk for hours and hours and hours, but I intentionally kept it short today, just enough to tease you a little bit about biomechanics. So I'm honored to be here. Thank you so much for having me. I'd love to meet every one of you. I'll stick around as long as it takes, and I look forward to it. Thank you.